Rheumatoid arthritis is a chronic inflammatory disease that affects one or more joints, causing swelling, pain, and stiffness until reaching a limitation of movements and a loss of functionality of the affected joint. It is a disease with an autoimmune pathogenesis, as some components of the immune system mistakenly attack and destroy healthy tissues, in particular the joints with synovial membrane, a thin membrane of connective tissue that lines the inside of the joint and has the task of producing synovial fluid. It is a viscous fluid that has the function of lubricating and protecting the joints from wear, like a small cushion that reduces the friction generated during joint movements. Worldwide, rheumatoid arthritis affects 0.5 to 1% of the population, with an incidence that is 2 to 3 times higher among women than men. The onset of the disease can occur at any age, but the group most at risk is between 40 and 60 years of age. An early diagnosis allows to recognize the onset of rheumatoid arthritis in time, modifying the prognosis and evolution of the disease, and therefore starting the right treatments immediately. However, it is not always so easy, as early symptoms are often underestimated and neglected by the patient himself. In this video, we will see what are the most common initial symptoms of rheumatoid arthritis. Joint pain. One of the first symptoms of rheumatoid arthritis is joint pain that usually worsens after a period of inactivity or rest, for example in the morning after waking up, and can last for many hours. Pain, which tends to gradually improve over the course of the day thanks to movement. Joint pain refers to a painful manifestation, often accompanied by swelling and inflammation, affecting one or more joints of the body, a complex of anatomical structures that keep two or more bone surfaces in contact. Rheumatoid arthritis usually affects the joints symmetrically and bilaterally, that is, on both sides of the body. Typically, the first to be affected are the small joints of the fingers and toes, wrists, ankles, and knees, which become inflamed, hot, swollen, and difficult to move. Pain thus tends to occur even following the execution of simple and banal movements, resulting in the more advanced stages of the pathology, a serious limitation of the functionality of the affected joints, and a significant worsening of the quality of life of those who suffer from it. As the disease progresses, the pain can also extend to the shoulders, elbows, and spine, with possible involvement of the spinal cord. Joint stiffness. The pain is often accompanied by a certain joint stiffness, which is nothing more than the result of the inflammatory process affecting the joint tissues and their relative swelling, due to an accumulation of fluids in the soft tissues which surround the joints. Stiffness that occurs mainly in the morning and generally persists for more than 60 minutes after waking up. It manifests itself with a decrease in flexibility and a reduction in the range of movement of the joint affected by rheumatoid arthritis, consequently leading to its limitation. In medicine, we speak of ankylosis to indicate a partial or total loss of mobility of mobile or semi-mobile joints following damage or a fusion between their bony components. The inflammatory process that characterizes this autoimmune pathology has an erosive and destructive course, as it can lead to a complete destruction of all those joint structures affected by the pathology and to the appearance of serious joint deformities. Among these, we find some structural alterations affecting the fingers of the hand, including the swan neck, buttonhole deformity, and ulnar deviation. When rheumatoid arthritis involves the foot, however, it can cause some deformities, called hammer toes or claw toes. Muscular asthenia. One of the most common symptoms in people with rheumatoid arthritis is asthenia, medical term used to indicate a state of generalized weakness characterized by a lack of energy and a feeling of chronic tiredness that does not tend to improve with rest. High levels of inflammation in the body and joint pain are the main triggers of fatigue related to rheumatoid arthritis. When the state of asthenia involves the muscles of the body, it is called muscular asthenia and is characterized by a decrease in muscle strength, estimated at a percentage ranging from 25 to 70% compared to healthy subjects. It is usually considered as the result of a reduction in muscle mass due to what is called disuse atrophy or inactivity atrophy. This is because the muscle tissue, as it is no longer stressed for long periods of time, experiences a decrease in the number of myofibrils, the functional units of the muscle. The state of chronic inflammation, pain, and joint stiffness caused by rheumatoid arthritis thus favor the immobility of the affected person and therefore the inactivity of those painful joints. Rheumatoid nodules. Up to 30% of people with rheumatoid arthritis may have solid lumps under the skin, called rheumatoid nodules. They can be single or multiple, superficial or deep, and have variable dimensions, ranging from a few millimeters in diameter to a few centimeters. Generally, they form more frequently in those areas of the body subjected to greater pressure or more subject to trauma, for example under the skin of the hands, feet, and elbows. In most cases, nodules are not painful unless they become infected, ulcerated, or when they begin to put pressure on one of the adjacent nerves. Rheumatoid nodules usually occur near the joints, but in rare cases, they can also form in other parts of the body, for example on the vocal cords, lungs, and heart valves. Although the exact process of formation of these subcutaneous nodules is not yet completely clear, one hypothesis is that they are the result of an accumulation of inflammatory cells. In approximately 2 to 5% of rheumatoid arthritis patients, inflammation affects not only the joints of the body, but also the walls of blood vessels, whether arteries, veins, or capillaries. In this case, we talk about rheumatoid vasculitis and manifests itself with different symptoms and signs depending on the type of blood vessel affected, as well as the extent of damage caused to the affected organ. In addition to general symptoms, such as fever and headache, we find numbness in the hands or feet, shortness of breath, itching or burning in the eyes, but also the presence of red spots on the skin or blood in the stool. Other symptoms. While pain, swelling, and joint stiffness are typical symptoms of rheumatoid arthritis, fever, on the other hand, is generally attributed to other medical conditions. Fever is nothing more than a defense mechanism of our body in response to a current infection, as it hinders the replication of pathogens such as viruses, bacteria, and fungi. The high inflammatory levels linked to rheumatoid arthritis often cause an increase in body temperature, especially in the late afternoon, and the onset of flu-like symptoms, accompanied by a general feeling of malaise and a loss of appetite, with consequent weight loss. Approximately 40% of rheumatoid arthritis patients have disorders that do not affect the joints. Examples of this include inflammation of the fibrous sac that surrounds the cardiac organ and of the serous membrane that lines the lungs and the inside of the surrounding chest walls. Often you can also notice dryness of the eyes and mouth due to inflammation of the lacrimal and salivary glands. If you notice one or more of the symptoms described, it is important to always contact your doctor or a specialist. The diagnosis of rheumatoid arthritis will be based on a combination of several elements, including the symptoms reported by the patient, the physical examination of the affected joints, and the results of laboratory and instrumental tests. As the Italian National Institute of Health reminds us, to date, there is no definitive cure for rheumatoid arthritis, but the available therapies can reduce inflammation and pain in the joints, prevent or slow down damage to them, limit disability, and improve the patient's quality of life.